on the scene, check the scene for safety. Check the victim for consciousness, gently tap their shoulder and shout.
Are you okay? Are you okay?
If no response, call 911 immediately.
You, call 911.
If the adult is lying on their stomach, turn them over into their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand on the center of the adult's chest. Place your other hand on top. With your elbows locked and arms straight, lean over the adult's chest and compress the chest 2 inches in depth, 30 times.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 30 compressions, give breaths. Give breaths by tilting the head back, lifting the chin, and pinching the nose. Place your mouth over theirs and give 2 slow, gentle breaths, just enough to make their chest rise. Continue with 30 compressions and 2 breaths.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Continue CPR until you see signs of life, another rescuer takes over, or help arrives.
Same thing in this scenario. Like you can see, the patient is basically not responding. We have to call the police, check for any vitals. Is she breathing? Pulse? Nothing. So the AED is here, and we're going to start by checking a heart rate, and then if shock if needed. So an AED, which stands for an automated external defibrillator, is a lightweight portable device that delivers an electric shock through the chest to the heart. The shock can potentially stop the irregular heartbeat, like an arrhythmia, or allow a normal rhythm to resume following a sudden cardiac arrest. Normally, sudden cardiac arrest occurs when the heart malfunctions and stops beating unexpectedly. If not treated within minutes, it can quickly lead to death. So how does an AED work? So an AED device is just a built-in computer which checks a victim's heart rate through an adhesive electrodes. The computer calculates whether the defibrillation is needed, and if it is, its recorded voice prompts the rescuer to press the shock button on the AED. The shock momentarily stuns the heart and then stops all activity. It gives the heart the chance to resume beating effectively. The audible prompts guides, as in this video, it guides the user through the process. The AED advises a shock only for ventricular fibrillation or another life-threatening condition, which is called pulseless ventricular tachycardia. AEDs are safe to use by anyone. Some studies have shown that 90% of the time, AEDs are able to detect a rhythm that should be defibrillated. The data suggests that AEDs are highly effective in detecting when or when not to deliver a shock. And where should AEDs be placed? Well, all first responder vehicles, including ambulances, law enforcement vehicles, and any fire engines should have an AED. An AED also should be placed in public areas such as sport venues, shopping malls, airports, airplanes, business, convention centers, hotels, schools, and even doctors' offices. They should also be in any other public and or private place where large numbers of people gather or where people are at high risk for heart attacks. They should also be placed near elevators, cafeterias, main reception areas, and walls and main corridors. And for infants, it's very similar to adults and child, except for infants we use only 2 fingers or 2 thumbs just below the nipple line and at least 1/3 depth of the chest. If there is no advanced airway or unsecure airways, we would do 30 compressions with 2 breaths for 1 rescuer, or if it's 2 people, it's 15 compressions with 2 breaths. And we just have to be aware of how deep we go with our fingers because we don't want to break the ribs as well.
Powered on. Stay calm. Child mode. Powered on. Stay calm. Follow the instructions. Remove clothing from patient's chest. Apply pads as shown on pads. Remove clothing from patient's chest. Do not touch the patient. Analyzing heart rhythm. Shock advised.
Clear.
Press flashing shock buttons. Press shock delivered. Start CPR immediately. Follow the metronome to give 15 compressions and 2 rescue breaths. Give 2 rescue breaths. 1, 2. Continue with compressions. Give 2 rescue breaths. 1, 2. Continue with compressions. Give 2 rescue breaths. 1, 2.
So just in summary, we should just, overall, before we attend to the patient, we just look at the patient, see if she or he is like suffering or having like an obstruction. If the patient is basically, do they have a pulse? Are they breathing? We have to do the ABCs if they have any circulation going. So airway, breathing, and circulation is very important. If the patient has a pulse, we either start ventilating them, or if they do not have a pulse, we still continue to do CPR. If that worsens, we should start, well, it depends on if it's in an infant or a child and adult, because each one has their own technique. So like for example, in an infant, we start doing CPR with either 2 fingers or 2 thumbs encircling, or in a child 1 or 2 hands, and an adult 2 hands would be preferable. For an infant, we should place our hands just below the nipple line. For a child and adult, it should be at the nipple line, which is the center of the chest, but not too close to the xiphoid process on the bone. The depth for an infant and child should be at least 1/3 of depth on the chest, approximately like 1.5 inches for infants or 2 inches for child, no less than 2 inches and no more than 2.4 inches in adults. The rate should be between 100 and 120 compressions per minute. And then for the ratio, it should be 30-2 for 1 rescuer, or 15-2 for 2 rescuers for infants and child, and in adults it's 30 compressions to 2 breaths for 1 or 2 rescuers. And if we don't, if it's not successful for the first 2 minutes, we just continue until the EMS comes by, and then they can take over, or if someone else can help you to do CPR, then that's also great too.